The jugular vein is the best site for collection of blood samples. The vein is large and less likely to collapse than are other veins in the body. Large quantities of blood can be collected from this site. Also, by using this vein for blood collection, leg veins are spared for possible catheter placement. Although large dogs can be collected while in a sitting position, we generally place the animal in sternal recumbency at the end of the table. The assistant pulls the forelegs over the edge of the table with one hand. With the other hand, the assistant grasps the muzzle and positions the animal's head. It is elevated and turned slightly away from the vein which is to be used. Excessive elevation of the head should be avoided, as it will tend to flatten the jugular vein, making it more difficult to palpate. The jugular vein must be palpated before venipuncture is attempted. With one hand, the jugular veins are held off at the thoracic inlet. With the other hand, the jugular vein can be palpated. Shaving the neck may aid in identifying a distended jugular vein. When dealing with show animals, shaving for venipuncture should be done only after the owner's permission has been obtained. The needle should be held ventrally at about a 140 to 160 degree angle to the neck, with the needle bevel facing the collector. The layers to be gone through should be thought about before and during venipuncture: skin, subcutis, and vein wall. When entering the vein, a decisive movement must be used to prevent the vein from rolling out of the way of the needle. When entering the vein, gentle suction should be applied by retracting the syringe plunger. In this way, blood will begin to fill the syringe when the vein is entered. Excessive negative pressure should be avoided, as it will collapse the vein and may lyse red blood cells. When the sample has been obtained, negative pressure should be stopped. After the needle has been removed from the skin, gentle pressure should be applied to the venipuncture site to prevent hematoma formation. Blood samples can be obtained from the cephalic veins in medium to large-sized dogs. The vein collapses easily in small dogs and cats. It is appropriate to use this vein for collection only when smaller amounts are needed, and when it is not necessary to save this vein for catheter placement. The animal is placed in sternal recumbency. The assistant uses one hand to hold the animal's head away from the collector, while the other hand is used to hold off the vein. This is accomplished by grasping the forearm near the elbow, with the thumb over the vein and the forefingers around the arm. The vein is rolled laterally with the thumb, and pressure is maintained against the vein in this position. The collector grasps the paw or carpal area with one hand as a distal restraint. The vein is palpated proximal to where the cephalic and accessory cephalic veins come together. The syringe is held at a 140 to 160 degree angle to the foreleg, with the needle bevel upwards. The layers are gone through sequentially: skin, subcutis, and vein wall. Negative pressure should be applied as the vein is entered and as blood is collected. Gentle on and off pressure can be applied to the paw as the sample is being drawn. This will facilitate blood return and sample collection. Negative pressure should be stopped before the needle is withdrawn. Firm pressure should be applied to the venipuncture site to prevent a hematoma from forming. Often, blood samples can be obtained more easily from the saphenous veins than from the cephalic. In the dog, we use the lateral saphenous vein, while in the cat, we use the medial saphenous vein. The animal is placed in lateral recumbency. 2 people may be needed to adequately restrain the animal and hold off the vein. The vein should be held off proximal to the hock and distal to the stifle. The thumb and fingers should be wrapped around this location, with pressure being concentrated on the caudal aspect of the leg. The collector should grasp the hind paw as a distal restraint. The line of the needle should follow the line of the vein. The bevel-up needle should enter the skin, subcutis, and vein. Lateral saphenous veins have more of a tendency to roll than cephalic or jugular veins. A gently decisive action is required to enter the vein. Slight suction should be applied to collect the blood, and on and off gentle pressure to the hind paw may facilitate blood collection. Prior to pulling the needle out, suction should be stopped. The venipuncture site should have pressure applied to prevent hematoma formation. The cat's medial saphenous is held off proximally using the side of the hand to apply pressure to the medial aspect of the thigh. The leg is held distally by the sample collector and the sample slowly obtained. Although this is a good site of intravenous injection in the cat, the jugular vein is the preferred site for blood sample collection. In order to obtain arterial blood for blood gas determination, we use a femoral artery stick technique. The animal is placed on its back with its hind legs spread apart. The pulsing femoral artery is palpated as it sits in the femoral triangle between the cranial sartorius muscle and the caudal pectineus muscle. The collector should isolate the pulse between two fingers. In this way, the artery will not only be localized for stick, but the femoral vein and nerve will be guarded from entry. The syringe is inserted at a 90-degree angle to the animal's body, traveling through skin, subcutis, and through the artery. Negative pressure should be applied and the syringe slowly withdrawn. Bright red blood will spurt into the syringe when the artery is re-entered. 1 or 2 milliliters of blood should be withdrawn from the artery. Negative syringe pressure should be stopped before the syringe is pulled out of the arterial puncture site. This is important to prevent aspiration of atmospheric air into the syringe. A cork should be placed on the needle immediately to prevent mixing of atmospheric gases with the blood sample. Upon withdrawal of the needle from the arterial puncture site, pressure is applied for 2 minutes to prevent hematoma formation.